Hi friends, good evening and welcome back to my channel Mukambika Nursing. Friends, here in this video we can see some important questions and its answers. In the previous video we discussed a set of questions, that is most expected questions and its answers. Here in this video again we can see the next set of questions for exam preparation. We can see the question. First question, morphine is an example of, and our options: option A synthetic drug, option B natural opium alkaloid, option C semi synthetic opium alkaloid, and option D all of this. Correct answer is option B, natural opium alkaloid. This morphine is an example of opioid analgesic. Okay, and here this category of this morphine is coming under natural opium alkaloids. This question was asked in AIMS exam 2011. So it's an important question. Some examples of this natural opium alkaloids include morphine, codeine, nosacapine, or some example of natural opium alkaloids. The next question, side effects of glucocorticoids includes all except, and our options: option A delayed wound healing, option B hyperglycemia, option C mental disturbance, and option D atopic dermatitis. Here correct answer is option D, atopic dermatitis. These glucocorticoids are steroid drugs. The action for the steroids is mainly anti-inflammatory action. And the main side effect of these glucocorticoids include delayed wound healing, hyperglycemia, osteoporosis, mental disturbance include anxiety, insomnia, depression, psychosis, and convulsions. And other symptoms include convulsions, edema, then risk of infections due to immunosuppression, then peptic ulcer, mental disturbances, hypertension. All are the side effect of this glucocorticoid. So except one is atopic dermatitis. Mainly the steroids are given to reduce inflammation. So dermatitis is an inflammation, atopic dermatitis. So it is given for atopic dermatitis. It is not its side effects. Okay, option D is correct. Next question, when performing physical assessment of a newborn with Down syndrome, the nurse suspects that the infant may have, and options: option A bulging fontanelle, option B unusual pupillary reaction, option C abnormal heart sound, and option D all of this. Correct answer is option C, abnormal heart sound. Okay, Down syndrome is the trisomy of chromosome number 21. Here bulging fontanelle and unusual pupillary reaction are not related to Down syndrome. The abnormal heart sound we can expect in a child or in a newborn baby with Down syndrome. And the next question, enteric fever is diagnosed by, and our options: option A blood test, option B Coombs test, option C Wadal test, and option D all of this. Enteric fever is also known as typhoid fever, and the diagnosis is by Wadal test. The enteric fever, the causative organism is Salmonella typhi, that is Salmonella typhi and paratyphi, and the test which is used to detect this enteric fever is Wadal test. Option C is the correct answer. Move on to next question. In intra-articular route of drug administration, injection is given into. Options are: option A arteries, option B atria, option C joint, and option D areolar tissue. Intra-articular route of drug administration means injections are given into joints. Option C is the correct answer, intra-articular injection. Which electrolyte is monitored while giving digoxin? And our options: option A sodium, option B chloride, option C potassium, and option D calcium. And the correct answer is option C potassium. While giving digoxin, we should monitor serum potassium level, because there is a chance of digoxin toxicity. So we have to Monitor the serum potassium level. If it is below normal means we should not give this digoxin to the patient. That may cause digoxin toxicity to the patient and there is a chance of sudden dysarrhythmia may occur to the patient. So we have to monitor serum potassium level before giving digoxin. Next question, antidote of copper poisoning is, and our options: option A atropine sulfate, option B D-penicillamine, option C sodium thiosulfate, and option D protamine sulfate. Here correct answer is option B, D-penicillamine is the antidote for copper poisoning. And remaining option atropine sulfate is there. This atropine sulfate is the antidote for organophosphorus poisoning, and sodium thiosulfate is the antidote for iodine, and protamine sulfate is the antidote of heparin. Okay. And the next question, which of the following anti-tubercular drug is avoided in young children? And options: option A isoniazid, option B rifampicin, option C ethambutol, and option D pyrazinamide. And the correct answer for this question is option C ethambutol, which is not preferably given for young children. Usually this ethambutol is not given children below 6 years of age because it is difficult to identify the color vision in children. So we are not giving anti-tubercular drug ethambutol for children below 6 years of age. And next question, the antidote of benzodiazepine overdoses. Options are option A lithium carbonate, option B naloxone, option C flumazenil, option D none of this. And the correct answer for this question is option C flumazenil is the antidote of benzodiazepine poisoning or benzodiazepine overdose. The next question is, which drug is used in the treatment of atropine poisoning? And options: option A methanol, option B ethanol, option C physostigmine, option D naloxone. And the correct answer for this question is option C physostigmine is the antidote of atropine poisoning.